I will skip some of the cards of the presentation because they will be available to you on the website, and I don't think it's to the benefit of this meeting here to tell you the details. So some of the stuff that in more detail represent the municipality, you will be able to find them in the website, and I will not take time now, like projects that we're doing and so on. So just to get acquainted, I will start with something of a joke, let's say. It's in a recent Simpsons episode, the Japanese tourist moves in with comic book guy. And this, of course, makes her father really upset. And he exclaims, "Daughter, you're coming back to Japan. There are 87 old people who need you to take care of them." Of course, this sounds like a joke now, but this is how the picture in terms of the old population will be in just a few years from now. So you see that the red zone underneath is showing population densities for over 65 that will be over 25%. We are talking about a world that is aging. So it has to age in a healthy way, in an active way, and the municipalities are the first line of support in this effort. It is our belief that healthy aging means active people, active physically, active socially, and active mentally. So our goal and our involvement in this project is actually to implement the procedures, the methods, the tools, and the policies that will help our population stay active in these three areas: the physical, the social, and the mental. So, along with these guidelines, of course, we have also the opportunity here to promote innovative activities for the health and active aging, create opportunities for market access of innovative services and products, and also exchange technical expertise in the area of silver economy with partners all over Europe. This project that we are presenting is a European-funded project, and it is with the cooperation of 5 European cities: Rotterdam, Pallini, Valencia, Rijeka, and Manchester, and also major partners including universities and research centers and institutions in the field of elderly people. In theory, the chronic care model is actually, let's say, a set of many different actions interacting together in order to have an informed, activated patient, and also a prepared and proactive team that supports you. The community resources and policies are the added value to the core of the health system, which is the self-management support, the delivery system design, the decision support, and the clinical information systems. All this is supposed to give us a functional clinical outcome that will prevent hospitalization and enhance the quality of life with ensuring active and healthy aging. This particular research has a specific pre- and post-control design. A generic template is constructed based on existing evidence-based interventions on the topics of the elderly, great literature in each country, and the needs and preferences of the main stakeholders. For example, elderly people over 70 years old, social and health care professionals in the primary health field, informal carers, and policymakers. So this first step that we will be presenting today is the results of this first phase that we have examined the needs and expectations of these 4 different groups: policymakers, carers, either family or some other person that has the official care of the elder, the healthcare professionals, and of course the elders themselves. Processes and all outcomes are measured at baseline and during implementation of each of the pathways, which are integrated pathways, social and health prevention, as well as at the end of the project. Integrating the results of all this, there will be a toolbox constructed containing instruments, policy documents, and protocols in order to disseminate the innovations of the Urban Health Centers initiative, and of course it will be available to all interested municipalities to be used and adapted as is fit. 2 focus groups with elderly people, 2 focus groups with professionals, 2 with informal carers, and interviews with policymakers were already completed, and I will be very concisely be presenting the results to you today. The focus group with the elderly. The problems that were recorded most urgently by the elderly, the first, of course, was problems and difficulties in accessing public health services. This is not something controlled by the municipalities, it's a central government function, the public health services, but utilization and access is becoming progressively more difficult in Greece, and either due to bureaucracy or due to the restructuring or due to the lack of personnel, the lack both in quantity but also in the locations that we can have access to them. Second, of course, recorded and it's expected, the financial crisis problems. It influences the health status, the ability to buy your medication, the ability to buy proper food for your diet that you're supposed to have, depending on your health problem. Many report the loss of connection with family members because they moved away to find a job. And of course, all the stress that is created by the financial crisis. Problems with the medication. The non-accordance to the pharmaceutical schemes is something that is the most common, to forget to take the medication, although most of them, they use some form of a pill box, either a daily pill box or a weekly pill box. And another thing that has come up with the restructuring of the health system in Greece is also that it has become very hard to get their prescriptions validated by a doctor each month. There are lineups, there are delays, there is a certain quota right now in Greece as to how many prescriptions a doctor can issue for free. So if you are not early in to get your prescription, then you go to the next category, which you have to pay an amount of 10 euros per prescription, and for people that are old and on a minimal pension, it is a problem. There are a lot of programs that they used to exist, providing domicile assistant or home care, that are now discontinued. It's another problem because it was giving a way out to people that had mobility problems or some other health problem that was constraining them in their house. The volunteerism from others, and from elderly to elderly even, it's very at a very low level right now. There is a lot over there that can be developed. Mobilization of citizens and resources in the community, it's something that they are not seeing yet. The need for carers, professionals, an organized state and municipality to support elderly, but in a coordinated fashion, not individually, each one of them to do whatever they can. In a coordinated, coherent fashion, to be able to provide a network on all these different multidisciplinary disciplinary professionals to work together and to be able to provide support. The information technologies, they're not in use with them, so that a lot of tools that we implement using the ICTs, or information that we think is disseminated because it's on the web. It doesn't reach them. They have no access to that. Some solutions that they suggest, and it becomes interesting because it shows you that they have a very pragmatic and realistic view of their needs, but they also have a very realistic view of what they would like to see. First of all, they would like information to be provided to them by the municipality in organized fashion, to be provided to them personally. And this is something that was really noted. The fact that there is somewhere a leaflet or a pamphlet with some information that you may go and pick it up, that doesn't reach them. They want it to be addressed to them. They want it on a personal basis information, either on a door-to-door basis or on events that are specifically targeting them. Financial help and health benefits from the state. People with minimal pensions right now, they always raise the financial help issue because the minimal pension right now is in Greece is between 250 and 300 euros, so it's very low. And this does not cover their basic needs. The creation of a network of services, this is being stressed over and over again. More doctors for prescribing medication, and of course, I mentioned earlier the problems with the prescriptions and then the quota issue. Universal access to services for the elderly. There are a lot of services that they cannot have access to them either because they are provided in unsuitable buildings or because they are far away and they don't have the transportation means to get there. The building of elderly homes and re-establishing of home care services. It's also something that is asked for. And services that guide the elderly where to receive the appropriate help, the personalized help. And a last issue that is being raised is the cooperation of the carer and the professionals. They do not feel that the people taking care of them, their family members, can get enough support so that they know how to handle them better. In respect with the carers, the focus groups, some of the issues that came up, the coherence to medication, the companionship, the lack of companionship, social isolation is one of the most important problems, and it actually affects them in a multitude of ways, physically, mentally, and of course, socio-psychologically. The preparation of the appropriate meal under professional instructions, people that are left alone or they live with a partial attention from some carer, they often eat things that are not appropriate for their diet, for their medical situation. Things as simple as the cleaning of the house, and the basic sanitary conditions that you should have in the place that you live. The minimization of the risk of falls. A problem for elderly people, not only because of the immediate consequences of the fall, but also of the side effects of the consequences, because immobilization in that kind of AIDS will certainly create other problems, circulatory and other problems that are associated with their health. The ability to obtain professional care at home. It's very expensive right now in Greece to have a medical professional come and visit. Their only solution for elder people that they do not have sufficient income is to go and stand up in a line, either at the emergency ward of a hospital to be examined there, or at a doctor's office that is associated with the national healthcare system. The carers also indicate that they need extra help because they do not live always near the person they take care of. They have many obligations. They cannot be all the time next to the elderly, and they worry, but without being able to do anything. Facts that they mentioned as important. Their knowledge of what the elders that they take care of say. The elderly in general do not trust strangers. They want to be independent and active, but moderately. They don't accept easily that they are becoming frail. It's something that we can all relate to, that maybe we are the last ones that have the self-cognition of our status. It's something that other people may understand much easier than we do. The people that they accept more easily care from are their husband, spouse, their children, their wider family, friends, neighbors, local community, and strangers are the last ones, including the fact that they may be professional carers. They are very, very restrained in accepting help from people that they do not know. They trust, of course, the doctors that they know for years, and they need professional advice, and they follow them better than advice from family carers. It's a matter, I guess, of authority. Solutions suggested by carers. They recognize that besides the elders, they need support. The carers themselves, as a group, they need support in order to care better for the elders. So they need support, they ask for support from a multidisciplinary team, medical professionals like doctors, nurses, psychologists, social workers, dietitians, physical educators, physiotherapists, etc. They want guidelines on how to care for the elderly according to the disease. They need some sort of a physical exercise program for the elderly. And they also need, and they ask for that, they ask for support groups. Give us the means of getting together, exchanging our ideas, our problems, so that we can find a better way to care for our people. Of course, the standard things like distribution of leaflets on what services are available to them so that they can see where they can turn to for help. Connection of the elderly with the surrounding environment, it's breaking the social isolation, reintegrating the people into their social environment. And support services specifically designed for the elderly by the municipality. Now, with regard to the professionals, the problems recorded by them, financial problems. This is always in the agenda. We are living in the age of the financial crisis. Problem with the medication. A lot of people, even if they get their prescription, they cannot pay their contribution because it's not covered 100% of the medication. So the contribution is becoming a financial burden to them, and they cannot cover it. And this sometimes means that they do not take their medication. Medication is important for them. Some of them are at below the poverty line, or they have a very serious disease that they are dealing with, and they cannot really address their external environment or be more active. We have to get to them, they cannot get to us. The elderly must be active, they must be socially included, is what we mentioned in the beginning. Active both physically, mentally, and socially. It's the three pillars for healthy aging. They have difficulties to memorize and implement the doctor's guidelines, so they skip steps or they improvise. Very few elderly people are accustomed with ICTs. They cannot, I will be very short. They cannot be used to assist them, remind them, bring them up to line. And the professionals themselves feel that too many responsibilities have been transferred to them. So, some of the solutions: focus on prevention services, a holistic approach, stability, programs that are run over a long length of time, not just pilot projects implemented here and now for a week or a month or a year. Specialized lectures from professionals, leaflets, guidelines in terms more addressing the carers. Health and social care professionals, they need to support, inform, train the carers. This is something that is recognized. A register system that will allow all this activity to be monitored and information to be flowing. Well-structured services with unequivocal orientation, and in parallel the involvement of volunteers. It's the only way in the midst of the burden that has been created by the financial crisis to maximize the effect that a municipality can have in protecting the elderly population to motivate volunteers. This is just a summary in terms of a graph of the main problems. I will not stick to them. The solutions we already mentioned to them. So the next steps right now after this is the implementation of the care pathways, the generic pathways and the specific ones for its deployment site. This will be completed by December of this year. Recruitment of the elderly in the control intervention groups, it's a control group study, will be from January to March, and the deployment phase will follow from April 2015 to July 2016. The final product is expected by December 2016 to be available to all municipalities, and of course anybody interested can contact us to have full access to it. Thank you very much for your attention, and sorry if I have taken more time.